Birth control pills contain different combinations of the hormones estrogen and progesterone to prevent pregnancy, but the pill has myths you need to be aware of. It's a myth that the pill makes you gain a lot of weight. This may be one of the most feared side effects of birth control and one that keeps many women from wanting to take birth control. The hormones in birth control pills could cause fluid retention, which could make you feel bloated, but it's not permanent weight gain. It's a myth that being on the pill can make it harder to get pregnant in the future. All reversible birth control methods will help prevent pregnancy while you're using them, but none have long-lasting effects on your ability to get pregnant when you stop. That's why people who use the pill but accidentally forget to take it for a few days can get pregnant that month. It's a myth that women over 35 shouldn't take the pill. 29% of pregnancies in women 35 to 39 in the United States are unplanned, as are 38% of pregnancies in women 40 and older. Healthy women over 35 can safely use oral contraception as long as they don't smoke, have normal blood pressure, and have no history of cardiovascular disease. In fact, you can keep using it until age 50. It's a myth that emergency contraception is the same thing as abortion. Emergency contraceptive pills work before pregnancy begins. Pregnancy begins when the fertilized egg implants in the lining of a woman's uterus. Implantation begins 5 to 7 days after sperm fertilizes the egg. Emergency contraception will not work if a woman is already pregnant. Emergency contraception works by delaying or inhibiting ovulation, which is release of your egg. It's a myth that antibiotics mess with your birth control. Most antibiotics do not make the pill, patch, or ring less effective. That includes antibiotics commonly prescribed for acne or sore throat or urinary tract infection or a vaginal infection. It's a myth that birth control pills can cause cancer. Taking the pill can actually cut your risk of ovarian cancer and endometrial or uterine cancer. That's probably because women who take the pill ovulate fewer times than women who don't take the pill. The more times you ovulate over your lifetime, the more hormones you're exposed to. The pill may slightly raise your breast and cervical cancer risk.